Good afternoon, welcome back to my channel. So today's video is exclusively for those people who are certified very recently and those who have completed their training but not appeared for their exam. Those are considered as non-certified medical coders. So this is completely for your interview preparation if you are trying for the job, or if you are searching for the job, or if you are planning for attending the interviews. So first and foremost thing, like, I don't want to waste your time by simply talking or something else. So directly we'll get into the video only. So first thing, what you should focus when you're preparing for your interview, certain things we have to be very clear. First thing is with your resume. Okay, so the resume should be an updated one which includes your photograph as well as your personal details, as well as your educational detail, as well as the additional certification program or anything you have done, that should be updated, and your contact number which you are using, okay, not the outdated one, the present one, as well as very professional mail ID. So when you are looking into your resume, first thing, like, you have to read your resume at least 4 to 5 times, because most of us, what we will be doing, we will be just copying the resume format from our friends, yes or no? So we will not be knowing like what is exactly written in the resume. Just we are doing the copy paste now. That's why when an interviewer is asking you to tell me about yourself, what you will be saying, like, you will be explaining all sort of things, and you will be telling like, I have a hobby of singing or dancing or something else, but in resume it will be written something, okay, so that there itself it will prove that you are not updated with your resume, or you have just copy pasted the resume. So whatever resume you have prepared, at least go through it 3 or 4 times, then only you will understand like what is exactly written in that. First thing is that resume preparation, go through your resume. Second thing, have a very pleasant colored dress. So you might be having doubts like whether I can wear, if girls means they will be asking like whether I can wear kurti or jean top, shirts or something. Whatever you're wearing, it should be very simple and elegant. That's it. Not it should not disturb the other person's view. That's it. So whatever you're wearing, make it simple and elegant. Okay. And the next thing what I have to say is, first thing is about resume, second thing about your external outfit, and third thing, please prepare, like before you go for an interview, practice at least 10 to 20 times in front of a mirror to speak about yourself. That is one of the first question, tell me about yourself. In that, most of the people know, they will be having only 2 or 3 points. When you sit in front of a stranger, you will feel difficult to answer that. So what you have to do is, stand in front of a mirror, tell me about yourself at least 10 times daily. So it should include, first thing, your name, second thing, where are you coming from, okay, third thing, for example, say my name is Danya. If somebody is asking me to introduce myself, I'll be telling I'm Danya, I'm coming from Trivandrum, I have completed my, tell your graduation and tell the completed year. I have completed my graduation in so and so, in the year so and so, in 2022 or 2023, whatever it may be. And then tell, I have completed my medical coding certification training from the academy, tell your academy name. And then you have to say, after my training, I have given my exam in the month of May, April, whatever month it may be, 2023, and I cleared my certification exam with 80%, 82%, 70%, whatever it may be. Additional to this, I have done a certification program. Apart from medical coding, any other certification program you have done, please add that also. That is an added point, okay. And finally only you should come to your family. Then you have to say, my family is a nuclear family which includes father, mother, my siblings, like brother or sister. That's it. That's enough. Don't go very in detail about family and all, okay. So this about self introduction. So that you have to really practice in front of the mirror at least 10 times, because self introduction is, if the HR is asking you to introduce yourself, it is like checking your confidence level. If you are not confident about what you are saying, in the first question itself you will be shattering. Okay, so make sure you are telling those things very confidently. Okay, that is the first thing. And then after self introduction, they will be asking you some personal questions like why you are changing your career from, maybe you are a BSc zoology student, now you are changing your career to medical coding. Maybe maybe a dental doctor, or you may be a Ayurveda doctor, and if you are changing your profession to your medical coding, they will surely ask why you want to change your profession. So in that thing, you should not degrade your profession. Exactly, like you might be having an idea now why you want to change this career. Make it very simple, and try to make them understand like what is the benefit of choosing the medical coding career as your career path. So tell that will be an important question, like why you are changing your career from your graduation to medical coding. That is a question. And next thing, you will be having an aptitude test. Aptitude test in the sense medical terminologies, anatomy, everything will be included in that question paper. Mostly it will be for some 20 marks. Okay, make sure you are giving all the 20, answering all the 20 questions, and you are getting 20 out of 20. So for this you have to prepare very well. Now we will be thinking, it's after all medical terminology only, no, it's abbreviation only, no, I'll be knowing. Nothing like that, it will be difficult only. So whenever you're getting time, just go through it, okay, and understand. And the next thing, after this aptitude test, if you clear that, next round will be the manager round. In that they will be asking you regarding anatomy system. So whatever system you are choosing to tell, say cardiovascular system, so study A to Z in cardiovascular system, not so depth, make it simple. Okay, make sure you are telling at least 30 points, 30 points from that system, and along with that you have to say 5 disease condition of that system, as well as 5 procedures which can be done from that system. So make sure you are telling it very precise and very clearly. Okay, so anatomy is very much important. So you have to go through it and you have to answer it very well. And when you are preparing for it, write 30 points and keep 30 points and keep, because you have to speak about that system for at least 2 to 3 minutes, so that you should have content, no? So you have to talk about that. And if you are clear with that, then they will be asking you questions from that system. So make sure, just Google and see, if you are choosing cardiovascular system, what all questions can be asked. They will be asking how many valves is present, what are the chambers, which is the main artery, which is largest vein, like that. Certain questions will be asked from the topic. So just Google and see what all questions can be asked from that system, and prepare it very well. Okay, and finally, if you are a certified coder, study the ICD guideline which is related to that system. If you are non-certified, then only till anatomy they will be asking you. If you are certified, study the ICD guidelines which is related to that system. And if you are saying all these things very confidently, and you will be moved to the third round. Third round, it is very simple. That will be HR discussion. They will be telling you about the shift timing, salary, packages and everything. So that finally they will be telling you like you are selected or you are not selected. This is the thing. So if you prepare really well, you can clear that interview in a very simple way. But don't be overconfident also. That's all I can say. Overconfidence will put us, will take us in wrong way only. So whatever you are studying, be confident. That's it. Okay, if they ask me question from this, I can answer it very well. So in this way, you have to prepare for your interview. Okay, so whenever you are preparing your resume, take at least 10 copies of that and keep. Okay, wherever you are going for interview, make sure, like one more thing I have to say, when you're going for an interview, if you're getting rejected, after 3 months only you can again give the interview in that same company. So make sure you are not getting rejected. Okay, that is the important thing. So if you prepare in this way, this will be the interview format. First they will be giving you aptitude test that you have to clear. Second round will be manager round. In manager round they will be asking you anatomy and all the system related question, as well as if you are certified they will be asking you ICD guidelines. And then if you clear all those things, then you will be move on to the HR round. So totally 3 rounds of interviews will be there, and it will be 1-to-1 only. There is no group panel discussion or anything like that. Okay, so be very clear and practice. If you are really looking for a job, practice only will make a man perfect. So study everything very neatly and very clearly. That will easily help you to pursue your dream job. This all I can say. And we have interview guidance program. If you are really interested, I'll add a contact number below. You can contact them and get registered also. Thank you so much. Thank you for your patience for watching this video. Thank you. Take care. Bye bye.